Hello, my name is Garrison Warren, and I'm with Tennessee Medicare Assist, a local nonprofit here in Nashville, Tennessee. I'm going to help you navigate through Medicare, whether you're new, already on it, or may know family and friends who are approaching that age. Now, I just want to let you know this webinar is strictly informational and will not contain any particular brands or carriers. If you have any questions, you can reach out to me. My contact information will be listed at the end of this webinar. Now let's get started. All right, let's get into it. Once again, I'm here with Tennessee Medicare Assist, and we are here to guide you through Medicare. So before we begin, just have to have a disclaimer. This event is for educational purposes only. There's no planned specific benefits or details that will be shared. And I, Garrison Warren, I am not connected with the federal Medicare program. Just want to get that out the way. All right. Decisions. Once again, this is whether you're new, already on it, but it's just a refresher. But yeah, let's talk about your choices. So typically, once you are eligible for Medicare, you will receive a Medicare and You book. It's kind of a thick book from federal government. There's also a digital version of this, but they'll typically mail you a Medicare and You. It pretty much outlines everything that you need to know. And a lot of people get these things confused. They use them interchangeably, but Medicare is an entitlement program and health insurance program for people who are 65 age or older, people who are under 65 with certain disabilities, people of all stages with end-stage renal disease. Now, Medicaid is, think of your state program. Here in Tennessee, it's what you would call TennCare. But it's a joint federal and state program that pays medical costs for those with limited income and resources. If you qualify for both, then you are called dual eligible. All right. I know we always see these letters and, we kind of get confused, but just know that original Medicare is Part A and Part B. Part A means the hospital care, and Part B means the medical services. Think of your doctors, physicians, specialists, etc. So if you know what Part A and Part B means, then you know way more than a lot of people. All right. Let's go over what Medicare Part A covers. Semi-private room, inpatient hospital services and supplies, skilled nursing facility care, 100 days max, hospice, all but 3 pints of blood. Let's say you go into the hospital. So there is a $1,600 deductible. Well, $1,632 deductible each time. So you have to pay that deductible each time you go to the hospital. It's not a one-time thing. So once you pay that deductible, days 1 through 60, you don't owe anything. Medicare pays it. 61 through 90, it is a $408 a day copay. Days 91 through 150, that goes to $816. And then after that, everything, you pay all the remaining costs. Here's what Medicare A doesn't include. Private duty nursing, private rooms, personal care items, custodial care, long-term care. Now, people who are, people inquire about long-term care, normally people purchase it separate, but we can have a conversation about that at our later dates. As far as skilled nursing facility care, days 1 through 20, Medicare pays that. 21 through 100, it is a $204 a day copay. And days 101 plus, you pay all the remaining costs. So, Part A, hospital insurance. There's no premium for Part A. But in order to qualify or to be entitled to Part A, you must have worked a minimum 10 years or 40 quarters or married to someone who has. As far as the eligibility, You can also qualify for it prior to age 65 based on certain health issues like end-stage renal disease, et cetera, et cetera. As far as who will pay the premium, people who have less than 10 years. So you will have a premium if you don't meet the qualifications above. Now let's get to Part B. So think of it as an 80-20. Medicare pays 80%, you will pay the remaining 20% of approved expenses. Services and supplies needed to diagnose your treatment or medical condition, health care to prevent illness or detect it at an early stage of treatment, most likely to work, durable medical equipment, ambulance services, clinical research study, getting a second opinion to surgery, and limited outpatient prescription drugs such as a infusion pump, nebulizer, chemotherapy, etc. So here's what Part B doesn't cover. Most dental care, eye exams, cosmetic surgery, acupuncture, hearing aids, routine foot care, long-term care. There is an application, whether you have Android or iPhone, it's called What's Covered. So as far as the premiums for Part B, everyone is going to pay this Part B premium. It's based on your income level, and it'll be deducted from your Social Security check if you are already on Social Security. Part B is optional. So a lot of times have clients who, once they reach age 65 or approaching it, and they're still employed, I'll tell them not to panic. Just enroll in Part A, and that's all you have to do. Because as long as you have employer coverage, that is what you call credible coverage. Now, there is a penalty if you don't have credible coverage and you wait to enroll in Part B. That penalty will be 10% for each full year, period, eligible but not enrolled. And as far as the state Medicaid program, there are programs where the state pays the premium for those who meet certain income guidelines. And that annual deductible for this year is $240 as far as your Part B premium. Or Part B deductible, I'm sorry. All right, I mentioned the income levels. So here are the brackets. So as you can see, depending on your income, whether you file individual or jointly, that coincides with the monthly premium. Now, just be mindful that they look back every 2 years. So just be mindful if you ever sell an asset, like you sell a house, and your income increases, then retroactively your premium can go up. But then once you go back to your regular income level, then that's when you can see your Part B premiums go back to normal. So just keep that in mind, whether you sell a house or acquire certain assets, that'll cause your income to spike. All right, so here are your options. You can do Medicare supplement plans or Medicare Advantage. There's a big difference, but we will get into that. But it really just depends on your situation. I always tell people, first of all, I ask them questions first, and then depending on how they utilize the doctor, et cetera, then that's when I go into the recommendations. All right, let's get into it. All right, so Medicare supplement, it's also called Medigap. So these are all going to be identical plans. They are under strict government guidelines. They are identical in medical benefits. So no matter what brand you get, the benefits are the same. Now, the thing with Medigap plans or supplement plans, it's a la carte, like I like to call it. You have to piece it together. You have to pay for the actual health plan. You have to purchase a standalone drug plan, and also you have to purchase your own separate dental, vision, and hearing plan. So here's an example of the Medigap plans or the supplement plan. So like I mentioned, all of them are equal. So no matter what brand you get, you got plan A, B, D, G, K, L, M, and N. So typically, as you can see, plan G, it is the one that covers the most. It covers everything but that Part B deductible, which was $240 for 2024. But other than that, once you meet that deductible, it covers 100% of all of that. As far as the prescription drug plan, like I mentioned, if you're on a supplement plan, you have to purchase it separate because the supplement plan itself does not include a drug plan. But carriers, they offer separate drug plans. They can range in price, but either way, the biggest advantage as far as going with a supplement plan is that wherever Medicare is accepted, then you can go. You don't have to worry about a network. As long as they cover, as long as they accept Medicare, then you're fine. Let's talk about Part D. So Part D is the drugs. Anyone who is entitled to Part A and or is enrolled to Part B. Now, typically people enroll in Part D as soon as they're available or eligible in regards to, let's say you're leaving your employer's, insurance. Typically you'll enroll in Part B and D as well, because when you're still under your employer's coverage, you have their, it's called credible coverage, so you won't need Part B or D just yet. All right, so let's talk about the different phases. Typically, well, this is going to change in 2025, but they have actually capped what you would pay for drugs in 2025 to $2,000. So those with the specialty drugs, the more expensive drugs, you're now capped at $2,000 out of pocket. And also they do have a situation where you can actually pay down or pay over time if you have specialty drugs that are expensive. But typically people who have generic drugs don't meet the that point in time anyway, as far as like spending out of pocket on drugs. If you have your generic blood pressure, cholesterol, etc. like that, typically you won't ever even reach that amount for out of pocket drug expenses. And here's just an example of how drugs are priced. Like they can do mail order. Even with Medicare, they have in-network pharmacies, which you get better ratings. So it just really depends on the medication you take, how often you get them filled, et cetera, et cetera. All right. Here is the Inflation Reduction Act of 2022 changes. So 2022, they made over-the-counter hearing aids available. Of course, last year they did a $35 a month on insulin. They capped it at that. 2024, the catastrophic drug coverage, 5% copay goes to $0. Like I mentioned before, next year there will be a $2,000 annual drug cap. This includes copays, deductibles, coinsurance, and the Medicare prescription payment plan. And then in 2026, maximum of 10 drugs eligible for price negotiation, 15 in 2027, in 2028, and 20 drugs in 2029. So here are the first 10 drugs selected for price negotiation. And then, like I said, if you waited, there is a Part D penalty if you do wait. But typically, people enroll in Part D once they enroll in Part B. All right, let's talk about Medicare Part C, which is also known as Medicare Advantage. We've all heard Medicare Advantage many a time. So Medicare Advantage plans, they're broken down. You have your HMOs, HMO POS, the PPO, and then you have special needs plans, which, as mentioned, special needs is when you're dual eligible for Medicare and Medicaid. HMO, of course, it's you have to, have a network, referrals, but there are some HMOs where you don't need a referral. PPOs is when you can go out of network, but you'll pay a higher cost. All right. So here's an example of what Medicare Advantage plans cover. Typically, you have copay. So normally with your PCP, you don't pay anything. Copays, it can vary. I've seen some from 15 to 40. Now, as far as the deductible that I mentioned earlier, that $1,600 deductible, when you have an Advantage plan, you don't have to pay that, but you do have to pay a initial copay for the first 5 to 6 days if you are admitted to the hospital. As far as preventative care, your routine checkups, you don't really pay anything for that. The ER visits can vary. Medicare Advantage plans does include a drug plan. It includes vision, includes dental plans. They also feature other extra benefits, you would say, like Silver Sneakers, which is a fitness program. You get a free membership to your gym of your choice. Some plans have over-the-counter allowances each quarter, so they have a site where you can just purchase over-the-counter items, and you can use it quarterly. And even if you're released from a hospital stay, some plans will actually have meals delivered to you. So here they are side by side. So, like I said, it just really depends on your situation. Medicare Supplement, no copays. There's a $240 annual deductible. So once you get $240, pretty much everything else is paid for. But you got to add the separate drug plan. You got to actually purchase separate dental, vision, and hearing. But people like this because they have freedom and they're not limited to a network and limited out-of-pocket expenses. Now, as far as the Advantage plan, depending on which one you're in, if you're in PPO, you have a little more flexibility. HMO, you're in network. There are copays. There are out-of-pocket caps, but a lot of times I tell people if they don't go to the hospital frequently, then they won't ever reach that out-of-pocket maximum. But people like this because most Advantage plans, they actually have a $0 monthly premium. So it doesn't cost you to have the actual plan. However, you are paying that Part B premium every month. So, like I said, everything's included, but, you just have to base it off your situation. So here's the pricing on how it can go, right? So the Medicare Supplement, you're going to pay a little more. However, like I mentioned, you don't have any copays once you reach that deductible. There's no network. As long as Medicare is accepted, you can go anywhere. There's no 80-20. But the only difference is, you're paying a monthly premium and you're paying for everything separate. But you have a lot of flexibility and freedom. Advantage, here's the pricing as well. Like I said, Part A, typically most people meet the Part A requirements, so they don't have to pay for it. That Part B, we can't avoid it, and it depends on the income level, but you're looking at roughly $304 for the supplement plan, and then $174.70 monthly for the Advantage, which is your Part B premium. So it's about $130 difference. Like I said, it just really depends, and just depends on your situation. All right. When is it time to enroll in Medicare? So you have 7 months. You got 3 months before you turn actual 65, your 65th birth month. Then you have 3 months after. And this is called the initial enrollment period. So once again, 3 months before the actual birth month, 3 months after. I always tell people need to get on top of it earlier because, as you know, the government can move a little slow, and especially if you're trying to time it up with you retiring and leaving your employer's plan, yeah, I'll recommend that you get in contact with them so that there's no gap in coverage. So once again, we talk about the initial enrollment period. So there are special enrollment periods. So you can be coming off your group health plan after you turn 65. So once you retire, let's say you're age 67, 68, 69, what have you, and you're finally ready to retire, then you have a special enrollment period to actually enroll in an Advantage or supplement plan. You have the general enrollment period plan where it starts from January 1st through March 31st. And you can either disenroll from your Advantage plan or make a change. The open enrollment period, like I said, you can switch to Advantage or disenroll, or go to a Medicare supplement plan. But just know, if you go from an Advantage plan and then you go to a supplement plan, it will be underwritten. Now, when you're initially eligible for a supplement plan, or let's just say you're initially eligible for Medicare, if you do decide to do a supplement plan, then you will be, it is guaranteed issue. There's no underwriting. You will be approved, and so on and so forth. But if you go from Advantage to a supplement, then that's when they'll have to go through underwriting, and it can be a little more expensive. And then the period that we're in currently is called the annual enrollment period. This is just Medicare Advantage and drug plans only. So this is time where people shop around, because a lot of times what happens is plans change. People get notifications that the plan that they had will no longer be offered in the following year. So we have time to make changes between October 15th and December 7th. But the one that'll be effective is the one that is the plan that we last enroll in. So let's just say today we enrolled in plan A, but then changed our mind and we did another plan. Then that plan, the last plan, will